Good morning. It's really today a wonderful day to bring people together and highlight an incredible moment of generosity, of community, in really the best in what we have seen in so many ways during this COVID-19 crisis. I've often said throughout this entire crisis, this pandemic, that we're not talking about statistics, we're not talking about numbers, we're talking about people, about human beings. And today we're going to talk about three human beings. And we're going to talk about two individuals within our community that at the height of this pandemic volunteered to make the ultimate gift of life and to donate their kidneys. We saw countless acts and continue to see countless acts during this crisis of people in our community stepping up, of offering help, of offering hope, a willingness to do whatever they can to support others during this time. This particular story, and I'm going to ask Dr. Oscar Serrano, one of our transplant physicians, to come forward in a moment and to give the specifics around some incredible human beings, an incredible set of circumstances. But to me, it highlights so much, and it really brings together what we're seeing day in and day out, which is people being willing to step forward and do what they can for others. So if I can, I'd like Dr. Serrano to come up and introduce our patients. And this is such a great recognition of multiple people making the donation of their kidneys to help another person and ultimately helping people from far and wide around the country through the chain of donations of their organs. This is the gift of life, and there's really, I think, no other gesture that we see in healthcare that is more generous, more altruistic, more humanistic than when these moments occur. And I would just point out, before I ask Dr. Serrano to come forward, we often described our healthcare heroes and the people working on the front lines, and they're amazing. Our physicians, our nurses, every person who works within our system during this time period. But the transplant program we're going to describe right now, it's one of the best examples because it never shut down. During all of the precautions, all of the protections we had to put in place during the pandemic, the transplant program is a lifeline for so many. And it had to modernize, it had to innovate, it had to change the way it provided services, the way it connected with our patients, but it never stopped doing what it does because of the essential nature. So we're really proud, and this particular set of circumstances is a good example that despite the worldwide pandemic, we've been able to really provide this life-saving care. So again, thank you for joining, and please, if I can ask Dr. Oscar Serrano, physician from our transplant program, to come introduce our patients, who in and of themselves, our patients are heroes, and this is an example that really shows how patients in our community are true heroes. Please.
Thank you very much. It's my pleasure to be here this morning. As Mr. Flaks said, this story to me is a remarkable story of individuals because at the end of the day, that's what we do as physicians, as nurses, as healthcare providers. We take care of people. The COVID-19 pandemic has certainly made life difficult for us. It has made our work difficult. It has made work for our patients difficult, and it has made their life difficult. This has been documented over and over again in journal articles as well as newspaper articles. The story that we're about to tell today is a story, in my opinion, of resilience, altruism, and it's a story that is humbling to those of us who participated in it. Nick Kalogeros is a young man who has a wife and a young child, an 18-month child. When I first met Nick, I resonated with him because he had a young child just like I did. He also happens to live in Glastonbury, which is where I live. So to me, he is a neighbor. He is just another human being who lives near me. His story is unique because he suffers from a genetic condition that basically led him to end-stage renal disease. When Nick was approaching end-stage renal disease, he became very proactive. He and his support cast, which is what I call his mother, who happens to be a nurse, and his wife, got into the trenches and basically went out and sought the options for Nick. The options for anyone who has end-stage renal disease can be a deceased donation or a living donation, which is, in my opinion, the best way to go. Living donation portends a better outcome in terms of life of the patient, life of the kidney allograft, as well as kidney that works immediately and rejects less. So with the help of our living donor kidney transplant program, Nick and his support cast began the process of using social media, using word of mouth methods in order to connect with people. So those that may be compelled to donate a kidney, to maybe even just inquire about it. Judy Edwards is another remarkable individual. She is another Glastonbury citizen, one of my neighbors, who happens to have an incredible story herself. She's also a young woman, has a daughter, a husband, she works full time, and yet she happened to notice a poster at a coffee shop in Glastonbury, a coffee shop that my wife and I often go to. In the poster, it talked about Nick's story, and she felt compelled to call the phone number and see if she could potentially be a match. In the meantime, another incredibly altruistic individual, Tyler, Nick's cousin, Tyler Kalogeros, also started the process of evaluation, which is a very intensive process, to see if he could be a match for Nick. In the end, Nick was approved to be a living donor before Judy, and he ended up donating his kidney to Nick. During this whole pandemic, there were some delays in the transplant occurring, and in the meantime, Judy got approved to be a living donor, and she decided that even though she wasn't going to be able to donate to Nick, she was going to move forward with donating in a non-directed manner. So I was fortunate enough to not only do Nick's transplant after I had obtained the kidney from Tyler, but also did the donation operation for Judy and eventually sent her kidney to Arizona, where it was successfully transplanted. So I'm very happy that we are here today to celebrate these three individuals who have made sacrifices, who have fought for the gift of life, and who have made someone else's life better in the process. So Nick, it's been a few hours since I last saw you. I saw you yesterday in clinic, and I said hello. How are things going now?
Going good, going very good. I'm up and active. I'm going to try to drive for the first time today, and it's 5 weeks on Thursday since the surgery, and things couldn't have gone smoother for me. So, the whole team, the whole transplant team has been great to me, and I'm looking forward to going back to living a regular life again.
So I think those words ring true to me. I hear them from patients all the time. Can you give us an idea of what living a regular life is now versus what it was before you had a transplant?
Sure. I mean, from having really strict diets to make sure that I don't overwhelm my original kidneys, to multiple appointments with nephrologists on a monthly basis, to switching out medications, monthly. I was on dialysis for a year at home, which pretty much restricted me on a daily basis to be able to go out at night or be able to take care of my son at night, because I was hooked up to a machine. Whenever I would have to do work trips, I would have to bring a big machine with me and a bunch of medication, and I wouldn't be able to really attend a lot of nighttime work events, because the dialysis process for me would take between 8 to 10 hours a night, and I would have to start around 7:30 to make sure I was up and ready for work on time the next day. So being able to attend a lot of new events and be able to tend to my son a lot more and be involved in a lot more work and family activities is going to really change things for me. And just to be able to not have the restrictions or the worry about if I'm doing is good for my kidney is going to be a real difference for me. And it just makes things a lot easier for my life.
Judy, I want to say hello to you as well. It's been a few weeks since I last saw you in clinic just to check up on you, and you were doing remarkable at the time. Can you give us an idea of what compels an individual to even think about donating a kidney, much less going forward with donating a kidney?
Yeah, sure. So great to talk to you. Yeah, still doing well. All good on this end. I honestly think for me, I was compelled by some of the verbiage that was in the sign that Nick and his team put up. Because Nick listed his blood type. I knew I wasn't a match for that blood type, but he talked about paired exchange and paired donation. I had no idea what that was. So I probably visit that coffee shop a little more than I should, but I saw it a couple of times and, finally thought, let me see what that's about. The sign itself just spoke to me. There were pictures of Nick's family, et cetera, there. So I took the couple of minutes to give a call and talk with the incredible transplant coordinators. What a great team you all have there, and heard just the incredible process and the incredible work that's taking place throughout the transplant community and kind of how things work when folks donate. I honestly feel like the education that I received, the way that all of my questions were answered, the above and beyond opportunity that folks continually took to say, this is a choice. You can proceed if you want to proceed, don't proceed if you don't want to proceed, to me was really just made me feel like this is something that I could potentially do. This is a way I could potentially make a difference. And I really felt like my best interests were preserved. I can't tell you how many times I heard from the team, you're healthy and our goal is to keep you healthy for the long run. And so that being the case, I was really able to make an educated decision to say, I can do this. And there's a very high likelihood that I'll be healthy for the long run. And so, quite frankly, why wouldn't I do this?
I think you're absolutely right. And I think what you say is exactly the intent for why Hartford Hospital established the Center for Living Donation. We wanted to educate our patients, we wanted to support them, and we wanted to bring something to the community that wasn't there before. Just as in your example, as well as Tyler's example, you have literally given life to someone else and have allowed them to move on to a normal life. And we believe that the way to accomplish that is by educating patients so that they make educated decisions and bring down some of the misconceptions around kidney donation. Tyler, I've actually never met you, but I've met your kidney. How are you doing?
I'm doing great. As Nick said, we're about 5 weeks out from surgery, and if I knew it was going to be this easy, I would have done it a long time ago. But glad I waited. So Nick ended up with a kidney. But yeah, my story was slightly different only because I live in the Washington D.C. area. I'm not in Connecticut, and I had initially thought that maybe I would have my surgery at Hartford Hospital and had even gone through the testing process there and realized that for recovery reasons I would want to be closer to home. And I think with the onset of COVID, I'm actually glad that things worked out the way that they did so that it wasn't even more complicated by the pandemic.
Right. So what you described is what most of the programs do around the country, which is if someone is going to donate a kidney directed, which means that you donate specifically to Nick, we would have you come up here, which is kind of a nuance of the process, and it's also tedious for you because you have to travel. In the United States currently, there are a lot of disincentives for kidney donation, one of them being that in the majority of the time, the donor comes to the transplant center and has to stick around for a few weeks until you're doing better. But again, the COVID-19 pandemic has really demonstrated to us that some of the processes that we had before probably weren't working to the best that they could have been. And so you guys were essentially the example for this, that we could remotely work with your physicians in Washington, D.C., and coordinate for this to occur through the National Kidney Registry. It is becoming now more common, in part because of the COVID-19 pandemic and people's resistance or apprehension about traveling elsewhere. Nick, if you can answer for me, how does it feel to have had two individuals, not just one, who wants to donate and be approved? So therefore, in this case, you didn't exactly have the choice because Tyler was approved much earlier, but we have had issues where patients need to select a donor, and it must feel overwhelming. But I'd like you to tell me a little bit more about that.
It is. It's exactly how I would describe it. It is overwhelming. It's incredible to, have two people want to donate. It's an incredible feeling, and I feel truly blessed to have, that kind of support and two people that want to do that for me. It's still indescribable to this day to be, and there's no way to explain how I want to thank everybody for doing this to me. It's basically another lease on life for me. It's another, 10 to 30 years of not having to worry about this, and I've been worrying about it for the past 20. So it's incredible. It's incredible. And honestly, to be able to, I haven't talked to Judy as much, but I'm sure I will be in the future. But I think my relationship with Tyler has gotten a lot closer over the last several months. And, the day he called me and told me he was going to donate a kidney, I think I was just in a state of, amazement for days. I couldn't describe how I was feeling, and I still can't describe how I'm feeling to this day. It's unbelievable. The generosity between these two people is just incredible to me.
It's remarkable. Judy, if I may ask you, can you describe for us what was the worst part about donating, as well as Tyler?
Yeah, honestly, the worst part for me was probably the fact that I donated right in the very small window before Hartford Hospital was allowing visitors to come back into the facility after the COVID pandemic. So, in my mind, I was going to have my family around me when we did this, and that's not how it turned out. It turned out to be just fine anyway. But honestly, that was the one thing. So again, I know things are back on track for the large part there. So if that's the worst of it, hey, like Tyler said, I would have done it earlier if I would have known.
And Tyler, what about you?
Yeah, similarly, telling my mom that she couldn't come because of COVID did not go over very well. But I think for me personally, really, I think there were a lot of stops and starts. Our surgery had to be rescheduled because of COVID, and so there's a little bit of uncertainty around what the timeline would be for that. And so I think that, like, getting mentally ready and then having to pull back and then sort of having that unknown element was frustrating. But really beyond that, I think from a physical perspective, having never had surgery before, I didn't know what to expect. And frankly, within a couple days I was up and walking around, and within a couple weeks I was back at work and sort of back to a relatively full function. So yeah, really it was just that my mom being upset that was the tough part.
Yeah, I think what both of you describe is been one of the biggest challenges for us as physicians and caretakers, in that family members and visitors weren't allowed in the hospital. We now have eased on some of those restrictions as a result of the COVID-19 pandemic. And once again, we've had to become creative, right? So we have allowed Zoom, which we currently are on, as well as other modalities to allow patients to communicate with their family. We understand how important the support system is at a time when people are ill. So what do you guys have to look forward to now this summer, especially given the restrictions of COVID-19? Nick, if you want to start us off.
I don't know with COVID, if it ends, if it doesn't end, I'm not really sure, but I know I'll be going back to work in a couple of weeks, and, as much as I guess,
And Judy?
my Zoom thing ended there. Let me see if I can reconnect. Sorry about that. But can you still hear me?
Yes.
Yes.
Yeah? Okay. I mean, with whatever time I have left to recover, I really look forward to spending time with my son and my wife and just being home and be able to, really enjoy that during this time.
And how about Judy or Tyler?
Go ahead, Tyler.
Well, I'm currently actually at a lake. You guys might be able to hear nature in my background. But I think we've just been sort of kind of laying low, enjoying time at home, and actually getting outdoors much more and spending a lot more time kind of in nature where it's safe and you can socially distance and kind of relax. Much more of that in the future.
Now, ditto what Tyler said. I feel like I'm moving a little bit faster every day. So back at work, and really looking forward to being able to get out and maybe do a couple of fun things with the family. Couple of maybe short trips, weekend trips, those types of things are in the future for us here. So excited about that.
Excellent. Is there anyone from the media that has any questions?
Hi, this is Daniela with WTIC. I'm just curious if there was any concern about being able to find that kidney donor considering the COVID-19 pandemic, and there have been conversations about people who have been nervous about going back to even just the doctor's office, let alone surgery. So I wonder if that was a concern.
Thank you for your question. It certainly was a concern of ours, which is one of the reasons why we had to postpone everyone's surgery here. With that said, some recent literature within the last couple of weeks has come out that for kidney transplant patients or for patients who have end-stage renal disease, weighing the risk of a COVID-19 infection versus remaining on dialysis and having the deleterious effects of that has to be weighed very carefully, because some literature is coming out that in the overwhelming majority of patients, COVID-19 seems to have a mild or moderate effect. We obviously hear the really bad effects of COVID-19, but again, when you juxtapose it with the risk of remaining on dialysis, we have to weigh the alternatives. So certainly for us, it was a consideration, which is why we delayed surgery for Nick and Judy, and Tyler's surgery also got delayed. But it was a decision that we made literally on a week-to-week basis when we could actually reopen the living donor program and start transplants again.
Thank you.
Any other questions? If not, I will transfer it back to Mr. Flaks for final comments. Thank you very much.
Thank you, Oscar. And I just want to first again thank Tyler, Nick, and Judy. You're healthcare heroes. You truly are, and it's inspiring. And when we see examples like this, it's Hartford Healthcare. It's why we exist. It's our purpose. This is the focus of our organization, to be able to create these types of miracles and support our community and to help people live their fullest and healthiest life. So it really is remarkable. I also want to just make two other comments. I was really struck by the comments of both Tyler and Judy around how visitation affected them. And I've described it many times as one of the most difficult decisions that we made at the earliest days of the pandemic. We were amongst the very first health systems to limit or eliminate visitation. But what I'm also most proud of is we were the first health system in the tri-state area in New England to restate visitation and to understand how important that is. Family-centered care, figuring out the safe and safe ways to invite families into our institutions and help them care for their loved ones when they're most vulnerable is incredibly important. And hearing that that was the most challenging set of circumstances in this donation really underscores why it's so critical to always ensure that we have access and that we do everything possible safely to support visitation. And I'm really proud our organization has continued to keep that as our primary focus, and it was really underscored by both Tyler and Judy's comments today. And lastly, we described so many times during this that I don't want to see us in healthcare go back to normal. We're going to be better than normal. And today was a wonderful example to hear the innovations that were put forth, the new practices that were discovered, the new ways to do things safely and more broadly in this transplantation. Multi-person transplantation is just a wonderful example of how we can be better and how we're going to learn from this pandemic and how it's going to help us become a better organization, providing higher levels of care, better access. So thank you so much. And again, we're so grateful, Nick and Tyler and Judy, for joining us today, and for your bravery and your courage and your generosity to do this. It's an amazing thing, and again, it inspires our team to continue to work to even be better as we go forward. Thank you so much.